I want to have a minute or so to sum up a few things with us this afternoon. Remind us that we started a day and a half ago with an exploration of what ecosystem services were, and then looked at a specific locality, a couple of them, with some potential examples, specific examples in Puget Sound, the Great Lakes, the Gulf of Mexico, and the Aral Sea, and thinking about beginning to try to not only connect ecosystem services and human health, but what are some of the questions that need to be asked about how do we begin to measure both ecosystem services and begin to measure their connections to health. We considered the impacts of a variety of stressors. We know those much better in terms of their impacts on the environment and resulting decline in certain kinds of ecosystem services, but we have a much less robust understanding of the actual health outcome for humans. We know the connections are there, but measuring those health outcomes remains much more difficult to do. We had some great examples of site-specific issues like storm protection. We heard about in the Gulf of Mexico and elsewhere. Wonderful talk this morning about ecosystem restoration in Tampa Bay and the values of that. And you know that there are connections to human health there as well. But it's a matter of the metrics. And we talked about sustainable fisheries. The potential for aquaculture, what it's going to take to make aquaculture in this country work and be sustainable, and those are separate but related kinds of questions. And I'm intrigued to see the latest statistics personally on global fish production, because they're not very different from the targets that I saw and actually reported on in 1979. As to where we might be able to get with world fishery production based on FAO statistics at the time. We hadn't done a whole heck of a lot better. You still there is a limit to what the ocean produces. I think we've highlighted lots and lots of connections amongst oceans, coast, land uses, populations, and in some cases, health. But again, those metrics of health are where we really are lacking yet, and I think is very, very ripe for discussion. And this afternoon we've got, or now it's this afternoon, this morning, the end of this morning, we really got into what kinds of things will take to become more sustainable in marine food production, but also in global food production, land food production. And I guess my last reflection on this is, having been a roundtable member for several years now, and reminding us, myself, that this is the roundtable on environmental health sciences, research, and medicine. The environmental health sciences part always resonated to me, and we've had some wonderful workshops that tend to be topic-oriented. And this one, part that I really appreciated a great deal, was we began to look at ecosystems with humans in those ecosystems, and the changes in ecosystems, and how those changes in ecosystems turn out to affect all kinds of things that we often take for granted, and then in turn can have substantial effects on the health and well-being, right on down to the mental health, recreation, anxiety, jobs, as well as specific disease processes, or the eating of having the availability of healthful food to eat. So I personally have truly appreciated this, and I think what it does is, one, connects us really to the whole range of the environmental health sciences that we start out with in this roundtable, and then plows a lot of ground, or sets up a lot of questions, Lynn, that we can begin thinking of for future, not only for this roundtable, but where the nation ought to be applying some of its research investment for the longer term to really get at this nexus of ecosystem services and human health, and what do we do to improve both of these. So I'll stop there, and Lynn, see if you have anything that you would like to conclude with, or Christine, or anyone, before we finish up today.
Very briefly. Just very briefly, I think we need to give one last thank you to the IOM staff who are here today, and others who work behind the scene to make this meeting happen. This has been a wonderfully run session, and one thing everybody should be aware of, the session has been recorded, and each segment will be available for viewing on the web, and so it's a resource that we can use to make this information more widely available. I think that there's been a lot of very, very important information communicated at this meeting today and yesterday. We haven't had a huge number of people here to hear it face to face, but I think that we can all work to make sure that our friends and colleagues are aware of this information by disseminating the talks as webcasts, reuse, recycle, repurpose it, because this really is an important message for us to get across. The other thing, and then, so of course along with that goes my great appreciation to the speakers yesterday and today, that what we set forth was very challenging. We're asking people who ordinarily don't meet together and don't talk to each other to find a way to communicate across this divide of people who work on ecosystems, work on ocean ecosystems, and people who work on environmental health. And what this roundtable has been about all along really is bridging those gaps that we know exist in the way that we've all been organized, whether it's in academia or in government. And I really think that this meeting was very successful in doing that, bringing these communities together. We've got to do more things together in the future, as Paul said. And last but not least, what I want to say is that it does raise the question, this question of ecosystem services and how we manage them. I do think it brings us back to a very fundamental question about how we do environmental protection, and a need to re-examine that, and I think that this roundtable is well positioned to do that. So thanks to everybody, and have a wonderful afternoon. Bye-bye.